Inferior alveolar nerve block. This technique involves injecting an anesthetic solution into the pterygomandibular space, where the inferior alveolar nerve is located, before it enters the mandibular foramen. Injection technique and anatomical location. First, we need to identify landmarks. Locate the coronoid notch and pterygomandibular rave to target the injection site. Second, insert the needle in the pterygomandibular space, aiming towards the mandibular foramen. Don't forget to aspirate and inject. Aspirate to ensure no blood vessel was punctured, then slowly inject the anesthetic solution. Anesthetic effects and area of numbness. 1. Mandibular teeth. The anesthetic effect covers the mandibular teeth on the side of the injection. 2. Lower lip and chin. The lower lip and chin on the injected side will also be numb. Third, buccal soft tissues. The buccal soft tissues anterior to the mental foramen will be anesthetized. Follow us on our Facebook page, subscribed on YouTube and TikTok. Thanks.